So, Anthony, I don't know if I told you, in New York, they do this, the best doctors in New York. It's a big thing to get on that list.
Mm-hmm.
And, retinal surgeon, professor, all around cool dude that you just met, Dr. Ronald Gentile. He's always on that list, always. Like every time I see one of those lists. And, I got very lucky that I found you. And now I realize that you're the guy.
Well, I can tell you how that started. I mean, that really started with one of my chairmen who actually recruited me from Detroit to come back to New York City. And I think he acknowledged my talent, and he just kept supporting me. And he was one of these mentors who was, totally giving. He never asked for anything in return. So whenever it would come up and they needed someone for a lecture or a patient had complex surgery, guess what? My name would always come up because he was the chairman. Everyone in the country knew him. So anytime they asked him, hey, who's the best surgeon? Guess what? He would put me on the list. So I sort of thank him for that. And what happens is you sort of start, when people start telling you things, you start to believe it, and then you want to become it.
Right.
So you just sort of try to get better and better and better, and then this is what they say about surgeons: you're only good as your last surgery.
Mm-hmm.
Right?
Really? Okay.
Well, yeah, right. So I mean, how'd your last surgery? You're not a good. So you always try to improve. Listen, you're only as good as your last radio show, right? So
yeah,
right?
That's probably true.
Right.
Now, there's a couple things we want to talk to you about today. There's a study that's out right now. Now, are you an ophthalmologist? Are you a retinal surgeon? Like, what do we call you?
Okay, so I'm a board certified ophthalmologist, and ophthalmology has different subspecialties, and retina tends to be one of those subspecialties. So just to give you an example of what other subspecialties there are.
Yeah.
You have the general ophthalmologist that does cataract surgery, which is one of the most common surgeries that are done.
Mm-hmm.
You have glaucoma surgeons that just take care of glaucoma. You have cornea surgeons. You have refractive surgeons. So these are cornea specialists that do LASIK and do some of the refractive surgery. You got oculoplastic surgeons. These are ophthalmologists that specialize in the eyelid and specialize in the orbit. And then you got neuro-ophthalmologists. These are like ophthalmologists that know a little bit of neurology.
Wow.
So you can see how grand this field is and how many subspecialties there are. And remember, 100 years ago, this didn't even exist.
Right.
I mean, in the old days, there was one guy. Actually, in the old days, the surgeon was the barber. I mean,
Right.
I'm serious. If you go back in the history of medicine, medicine men were these very academic with the bow tie, and we had to get a pill, we had to get this medicine to treat this, we got to put this leech over here, we have to do this and that. And the surgeons were considered barbaric, right? Barbaric.
Right. Wow.
And you would go to the barber, and then they would, rip something out or grab a tool, and they became the surgeons.
That's where that red and white sign came from. Was from the blood.
Yeah.
That's where it started.
Yeah, exactly. So it's gone a long way. I mean, it's gone a long way. And then ophthalmology and ENT, ear, nose, and throat, were actually one combined group, and then they split up and became their own. So if you start meeting some of these old timer guys, that are in their 80s or 90s, they remember that they would either do ophthalmology or ear, nose, and throat. And they were actually, at that time, they were sort of boarded in that specialty that was combined. All the literature was combined at that point in time when you looked at the journals.
That's really interesting. And now I guess, so how come there's so many different specialties? Is that because the need arose, or did people start hating, be like, I don't want to be with the ear guys. Those guys are idiots. They can't see a thing.
Well, what happened is it's like New York City. Everything is specialized, right? So, you go to one restaurant and they serve one thing that you can't get anywhere else in the world unless you go to China in the hills. in this, esoteric in grandma's kitchen somewhere.
Right.
So it just got more and more specialized, and then people, what they did is they said, okay, this is what I'm going to do. I'm just going to do cataract surgery. And he says, well, what about the ear? You're not going to do the ear? Well, no. I have enough patients to just do cataracts. And that's what ended up happening. There was enough work, and they sort of specialized, and then they joined groups. I mean, retina surgeons now have their own groups. I mean, there's not, maybe there's about 4,500 of us in the United States. Mm-hmm. And we have formed a group, and we're sort of organized, and we share information. And nowadays, information goes real quick. I mean,
right. No, because I mean, it's good because when you that's a big thing. Like when you publish a study, it doesn't just stay in journals. It ends up. I mean, that's one of the reasons I wanted to have you on, because there's a study that I saw. I don't have access to peer-reviewed journals, the kind of things that you would publish in. There's a study that talks about how I thought this was fascinating. People like Ray Charles and Stevie Wonder. How being blind makes you a better musician, and that kids that are blind tend to have perfect pitch. Explain this to me. What is music and blindness? What's the connection?
This is what makes medicine so fascinating, because when you open your eyes are really, you're not seeing with your eyes, you're seeing with your brain. Mm-hmm. Okay, your brain is what's seen, and there's a portion in the back of the brain, the occipital cortex, which is where the images are processed. Now, this sounds strange, right? So you can go blind by losing your eye, right?
Right.
So you get a retinal detachment, and you go blind. You get glaucoma, and you go blind. You can also go blind, which they consider cortical blindness, by having a stroke. You can have a stroke in the back of the brain, or have traumatic brain injury, and actually go blind, and that's called cortical blindness. So really, we're seeing with our brain, and the brain is fascinating, because when you look at the brain and you look at how many neurons we have in the brain. Okay, we got 100 billion neurons in the brain.
Well, Anthony doesn't. The rest of us
I have
do.
7. I killed my first year of college. I killed half of those. So.
And he wasn't. He was born with a lot less than the rest of us, so he was already starting out handicapped.
Yeah. So this is what happens. Okay, you got 100 billion neurons. Okay, they're all connected to each other. Okay, so when you look at an image, all those neurons are being activated, and they're being processed. Okay. And those neurons are going towards your vision. What happens if you don't have vision at a young age, or you're born blind? What happens to all that brain matter that we've been using to see? What happens is it's used for other senses, right?
That feels like that was a fallacy. I feel like that was one of those cliche things, but it actually is true.
It's not. Actually, there was a study done that saw that patients that were blind from birth, when they looked at the brain that lit up based on the auditory cortex, it was almost 2 times the representation of someone who wasn't. So that area actually was larger. And this is true. I mean, I don't know if you've ever tried to read Braille. I don't know if you've ever tried to do this. Mm-hmm. Braille, those little bumps that you see, that a blind person, the tips of their fingers are so sensitive, they could learn that relatively quickly. If I tried to get you to do that, it would be almost impossible. It would be very, very challenging.
Yeah.
Our eyes get in the way. And I was doing some experiments. I mean, I told you that, do things smell better if you close your eyes? Do things taste better?
Let's find out. Okay, I have some coffee, so tell me what to do.
Okay, you're working too hard.
I love that you have wine.
Yeah, you can't have coffee at 8:00 at night. You're never going to go to sleep.
So what you do is, keep your eyes open and drink it a little bit, right?
Okay, take a sip. Mm-hmm.
Okay.
Mm-hmm.
Now close your eyes
Okay.
and do the same thing.
Try not to dribble on myself.
Tastes the same.
You don't think it's more intense? I think it's more intense.
It's more intense. It's definitely more intense.
It's more intense.
Why, how can you be drinking coffee at night?
I don't know how you do that.
I always do.
Okay, I have a question. We were going back to Stevie Wonder and all this. It is 2021 almost. Why can we not fix blindness by now?
All right. Yeah. Well, listen. Listen. We're way ahead of what we were, 20 years ago.
Mm-hmm.
Even and way ahead what we were 100 years ago. I mean, we have come up with treatments for macular degeneration over the past 20 years, where we have prevented blindness in patients with macular degeneration and diabetic retinopathy.
Mm-hmm.
Stevie Wonder suffered from retinopathy of prematurity. What we know now about retinopathy of prematurity, if we knew back then what we knew now, he probably wouldn't be blind.
Wow.
Back then, it was actually linked to giving babies too much oxygen in the incubator. And there was some brilliant scientists that sort of came here. There was some brilliant ophthalmologists who, wait a second, why is this kid developing a retinal detachment and this kid not? Why is this kid developing a retinal detachment? And someone just started noticing and put the data together and realized that when we were giving these little babies too much oxygen, they were developing retinopathy of prematurity and they were going blind. Oh yeah, this is so.
Wow.
So we've of course there's still blindness today. Okay.
Mm-hmm.
Is there less? Is there less as a result because of all this research?
So this is the problem. The problem is people living longer. Right.
Right.
So people are living longer. So
that's a big problem.
And you're more,
It's a huge
They
problem.
should just die.
so you're saying is like, okay, is there less blindness now than there was before? Well, I guess we have more people on the earth, and we got more eyeballs. And
No, but I mean less young people blind. Well, yes,
Yes,
less
I mean,
kids.
yeah,
I don't mean like old people going blind.
I would say yes, definitely. There's no doubt about it. I'm not going to say, listen, third world countries are a different category.
Right, of
I would
course.
say in third world countries, of course, people are trying to prevent blindness. Actually, it's crazy because if you look at some of these third world countries, some of the leading causes of blindness are preventable, and some of those are just cataracts. I mean,
Right.
here in the United States, if you have a cataract that just makes, gives you a little glare while you're driving your car, it's taken out. If you're in a third world country, your cataracts get so bad you can't even walk out of your house and you'll continue working.
Mm-hmm.
So
Right.
we definitely made a lot of progress.
But somebody like Stevie Wonder, we think in our head that he sees absolutely nothing. It's complete blackness.
Yeah.
Is that what they see?
Yeah. So it depends so there's different grades of blindness, right? So when someone says you're legally blind, what does that mean? Well, legally blind means that your visual acuity is less than 2200, or you have a very constricted visual field. Okay? So if I told you, hey, you're legally blind, but your vision's 20/20, how does that make sense?
Right, it doesn't.
But there are people who have 20/20 vision who are legally blind. That's because their visual field is very small. So if I gave you a pair of glasses where you had to look through a straw, you had to look through a straw, and you look at the vision chart, and you're like, oh yeah, A, F, and you're seeing the smallest letters. Actually, their visual field sometimes can be so small that when you put the big letter up, you can't see it.
Wow.
So you put the small letter, like, oh yeah, 20, and that's 20/20. You saw the 20/20 line. But guess what? They can't walk out of the room.
Because they have no peripheral vision.
They have no peripheral vision. But then you'll see patients who are legally blind, okay, that have very good peripheral vision, and they're functioning much better because they can make it out the door. They can use their peripheral vision. they can't, I mean, they can't read their phone unless it's very big. They can't recognize faces, but people tend to adapt, right? So you have people who lose their vision slowly, and they're able to adapt using technology and just using their environment to try to figure things out. The worst thing you can do with a person who has limited vision is to take them out of their apartment and put them into, and bring them somewhere else, because
Right.
they have to adapt to it.
Right.
So legal blindness is one thing, right? And then you got total blindness, which is blackness, okay? And I'm just going to, even if you close your eyes right now,
Right.
if you close your eyes right now, and
Okay.
you're seeing blackness.
Mm-hmm.
But that's not total blindness, because if I shine a light in your eye,
Right.
light through your eyelid,
Right. That's true.
okay? And people say, well, is that important to be able to see a little bit of light? What happens is their circadian rhythm, right, is based on you coming in contact with light. So if you have even a little bit of vision, okay, you could still have a normal circadian rhythm. And that means
if Anthony, or people listening don't understand, that has to do with your sleep cycle, right?
yeah, exactly. So
No,
the thing is-
cicadas are those little bugs that come out in the springtime. That's what I'm thinking he's talking
And
about.
only blind people can see them.
I can hear them. I can never see them.
See, you can't see them because you're not blind.
Oh, see, making total sense to me now.
but listen, it's a fascinating field. I'll tell you another thing, which is
Wait, hang on a second. So how do blind people sleep and get a good night's sleep?
So if you're totally blind, it's a problem. It's a problem, and there are drugs on the market, and you may have seen commercials on these drugs where they try to get your circadian rhythm back. But the thing is, even if you just see light, you can still have that rhythm.
Right.
And you see this, right? So you'll the thing is, you'll tell patients, like, I'll give you an example. If you really want to screw up your circadian rhythm, be on your iPhone all night, like what you guys are doing now with all these screens and everything.
Right.
That's gonna kill you. That's why you wake up like, where the hell am I? What time is it?
Right.
So that's why we tell, like, so if patients have difficulty sleeping, we try to say, hey, limit your screen time. After 6 o'clock, get off your phone, get off your devices, and get away from that blue light. The blue
Right.
light.
I've heard sleep specialists say that get off. Yeah, absolutely. That you should get off no screen time after a certain time so you can get some sleep.
Yeah, and it actually works. I'll tell you another fascinating phenomenon.
Yes, please.
It's and you'll like this, Anthony.
Okay.
It's called Charles Bonnet syndrome. Have you ever heard of phantom limb?
Yes.
Where
Yeah.
some unfortunately have an accident and they feel like their arm is still there.
Yeah.
Well, there's something that happens to the visual cortex, which is similar to this, where people actually lose their vision and they have visual hallucinations.
Oh.
Yeah, where they see things that are not
Oh,
there.
that would be horrible.
Whoa.
Yeah. And
Oh
the
my
thing-
God. I mean, like in college, there were drugs that helped you do that. I didn't realize that that's like a thing in real life.
Right. I once saw my refrigerator stand up and walk out of the room, but that was because of acid. So it was a high school thing.
Actually, the truth is, yeah, if you look at the books on visual hallucinations, yeah, drugs are number one.
They are number one.
Charles Bonnet is on the bottom there. So if someone comes in and complains, the first thing you ask them if they've been taking mushrooms or something.
Is Charles Bonnet related to Lisa Bonet?
No, not related.
They don't know each other?
No, not related. But what's interesting about this syndrome is that every patient's a little bit different. So some patients are scared and think they're going to go crazy.
Right.
And
Well, I mean, it's, of course, you're having hallucinations.
But I have other patients.
That's sort of the definition of crazy.
But I have other patients who actually take the other side and actually enjoy it. I had patient of mine who was an artist, and he said, yeah, he's having these hallucinations, and he said it was the most beautiful thing he's ever seen. He said it was a field of flowers, and then as soon as he sees this, okay, he tries to remember it, and he brings his easel out, and he starts to try to paint it, which is fascinating, absolutely fascinating.
How do you get that? Is it genetic? Is it something that people do? Dropping acid? I mean, are there things like this that we can avoid?
Well, the thing is, we just we don't go blind. I mean, I'd say that.
Okay. Are you telling me not to go blind? Because I don't want to.
That's it. Don't go blind. I mean, that's
okay. That was easy. So just look in the mirror. Is it like Bloody Mary? Just say to myself 3 times, "Don't go blind, don't go blind, don't go blind," and it won't happen.
Yeah, it could. Yeah, if you see the thing, what I think is there's a couple. I'm going to put together a top 10 of how not to go blind.
No masturbation.
Yeah.
Right. No masturbation is number 1. You gave away the lead.
They always said you're going to go blind, kid.
That's right.
See, as an eye doctor, you need to walk in every now and then and tell somebody, you really have to stop this. It's a 3-time-a-day habit. You got to stop because you're going to go blind. I see this chart. It's too much.
Or if a patient's already blind, you can be like, listen, you were told as a kid. You were told.
Anthony reminded you.
I'm sorry. It was too easy.
I would say that most blindness is probably avoidable. I'm not going to say all of it is, but most of it is. I mean, you're right. There's some genetic things that you inherit. We always got to blame our parents for something.
Right.
Where, you sort of unfortunately, develop a gene. But we're making progress even on that front in terms of replacing defective genes. And we are making some progress there in terms of preventing.
No, this is good because I blame them for my personality. I'd like to blame them for something else. So this is
right.
Great.
Have you ever had a subject that was completely Stevie Wonder blind and you brought back some type of sight to them?
Wait, tell him about the MTA, the Matthew, the MTA guy. Tell him that story.
Yeah. So okay. So
wait, let me just say, hang on. This made national news. This was a really big story. In case you missed.
Well, all right, but he's asking someone who was almost okay. So I'm going to go back 4 years.
Okay.
4 years ago, I was introduced to a young woman who got stabbed 30 times. 30 times in the face, and in both eyes.
No.
Oh my God.
And
who did it?
It was
somebody she knew.
It's a really sad. I mean, this story. I mean, actually, I still keep in touch with her. Okay, I consider her a patient and also a friend. Mm-hmm. It happened. She had a schizophrenic boyfriend at that time. Who showed up and did this. I didn't really know this at that time. The only reason why I ended up knowing more about it is because they brought us on the show called The Doctors.
Mm-hmm.
Right.
And they presented her and they put me on stage, which was which I actually learned a lot more about what happened to her than I knew even all I knew is she got stabbed 30 times and my job was to get her vision back.
Mm-hmm.
So she had no vision in both eyes.
Wow. And
she had multiple opinions with other doctors, and the doctors felt there was nothing they can do. And I found out that one of my fellows, this is one of the doctors that I was training, saw her and said, "Listen, Dr. Gentile is going to be here tomorrow. Why don't you come and let him take a look at you?" So she came in the next day, and I remember she walked in the room, and I said to her, we have to at least try. We got to give it at least one shot of trying to get your vision back. And remember, she was both eyes, so I had to choose which eye to operate on first. So I operated on the eye that had what I thought had the greatest potential.
Mm-hmm.
What ended up happening is we actually gave her vision back. We got her vision back to, we got her vision to about 20/80 in that eye.
No.
And she was using a device, which was something called eSight, which was electronic glasses at the time.
Mm-hmm.
And we were able to get her on the visual acuity chart. Now, I'm not saying her visual acuity is 20/20, but she was able to see the 20/20 line using these glasses, which gives you some magnification. And the greatest joy was for her to see her son graduate.
Oh,
wow.
That brought tears to everyone's eyes. Because what happened is, what we ended up finding out is, when the schizophrenic boyfriend broke into the door with the knife, he wanted to stab her son.
oh,
And she fought back. And
Wow.
that's how it ended up happening.
oh my God!
So,
what a
so
story.
that's the one. That, there's other cases that I've done like that, but I would say that's probably the most dramatic one. And that got headlines. That got me on a couple of radio shows. It got me on the doctor show. They flew me out to Hollywood at that time, and I finally got to see. I mean, I was always thinking, you go to Hollywood, it's gonna be, oh my God, it's gonna be so good. And I'm like, what the hell is this?
I know, it's a dump. I lived there for 3 months. I know.
Back to New York.
Yeah.
I couldn't believe it.
I don't smell pee. I'm not. I want to smell pee. That means I'm in New York.
And the crazy thing is, you wait around a lot. You just wait. And I'm like,
Yeah.
I got to do something. I mean,
Yeah, TV's the worst.
Mm-hmm.
Tell Anthony, the other story that I was talking about that made national news was the MTA conductor, Matthew.
Yeah.
And tell Anthony what happened with him and how you saved that guy's vision. I love this story.
Yeah, so this gentleman got impaled with a deer antler right through
his eye, Anthony.
No, when he was
right through the center of his eye.
Wow.
And this is a conductor. I mean, he's he has a little daughter. I mean, it was a freak accident,
Mm-hmm.
a total freak accident. And he ended up, it's interesting how he got to me. Okay. So he got to me because his wife is so tenacious and was making all these phone calls and called up the Mayo Clinic and says, I'm taking my husband to the Mayo Clinic because I got to see this doctor at the Mayo. So they get a friend of mine on the phone, okay, who I trained.
Mm-hmm.
I was did part of his training. We trained together.
Right.
And he goes, where are you? He goes, why are you coming to the Mayo Clinic? Why don't you go see Dr. Gentile? That's how he ended up. That's how he ended up getting to me. So, and then, because the thing is, I've been doing this for so many years, doing some of these really horrendous trauma cases. You tend to, you tend to know what to do. You tend to know what the prognosis is going to be. You tend to know how to get the best chance of success. It doesn't guarantee success, but you know what to do and what not to do, right? So what I think what happens with some surgeons is they look at something, and this is true in some parts of the world, where they look at the injury and they say, oh my God, there's nothing to do. I'm going to just take out the eye. And I'm like, there's other data points to look at.
Right.
That you want to see, that you want to say, wait a second, give it a shot and give it a chance.
Right.
And then once you say, hey, this eye has a chance, I have this whole protocol, and I have a lecture that I give doctors that goes through, how do you do it? How do you get to that point? And it's sort of, I have a video that has about 50 different segments of surgery. So for example, surgeries have, I would say, most complicated surgeries have probably maybe 1,000 different steps.
Mm-hmm.
But those steps can be combined into, into 50 different stories. And so what I've done is I've taken these 50 stories and I've made, 10-second videos on, okay, this is what you want to do. This is what you want to do. So that people have a better understanding of what the goals are to get to the best outcome.
Wow.
Yeah. So what ended up there is what happened is I never promised, listen, I don't promise anything to any of the pay. I say, listen, I'm going to do the best I can.
Mm-hmm.
That's all I say. I'm going to do
Right.
the best. Okay. And he comes in, so what happens is you do the surgery. And then during the surgery, you start working on the eye. And there's two vital structures of the eyeball, right? It's the optic nerve, which goes to the brain. And then there's the macula, which is the center of the retina.
Mm-hmm.
These two structures, okay, if you damage those structures, so if you cut the optic nerve, there's not much I can do.
Right.
Okay. Or if you put a hole right in the center of the macula, there's really not much I can do. I mean, I can improve your vision, but I'm not going to get you to really good vision. So,
Right.
sometimes I'll do surgery, and someone gets shot with a BB, right? And I do the surgery, and I'm like, oh God, the BB went right, into the optic nerve.
Oh, wow.
There's not, I'm not much to do.
Right.
In his case, when we did the surgery, I said, oh my God, it missed the optic nerve and it missed the macula, which is the center, by 10 millimeters.
Ooh.
We're talking about half an inch more total. You're not going to get any vision back.
Mm-hmm.
Right.
And then we follow that up with another surgery, and he comes in one day and he has 20/20 vision.
Wow.
We got him to 20/20, and
Oh my God.
I'm like, okay, when do I start doing my cartwheels? No, and listen, but we listen. I remember all the stuff that I do is based on people before me. Remember, the instruments that I'm working on have been developed by guys before me. We just keep making the tools better,
Right.
making the instruments better. Some of the surgeries also require surgeries from cornea surgeons. So, for example, in his case, he had a cornea transplant by one of my cornea surgeons that I work with. So it's really, I would say, sort of a group effort. But as you start, when you do these things over and over again, you really get good at it. Just like you guys, right? I mean, you've been doing this. All those awards you have won,
Right.
for your radio show. Guess what? It didn't just, it's hard work. You get to that point where, I watch you and I say, my God, it looks so hard. I mean,
Yeah, but the difference is, I listened to old demos of myself when I first started out and I was terrible. Nobody dies. If you're
Or
a terrible
loses
surgeon,
their vision.
if you're a terrible surgeon, people go blind.
Well, yeah, I mean, listen, the medicine is somewhat a little bit more regulated, right? I mean, you got to get we always have, when you're starting off, someone's watching you to make sure
Right.
you don't make any mistakes. You know what I'm saying?
Yeah.
I think maybe when you first started, did you have, it's like you had somebody that can just cut your mic.
Right, right.
Stop you from speaking.
Oh, we've done shows that I guaranteed nobody was listening or watching. I can almost guarantee it because we've tried to give away like concert tickets. Nobody called.
And they were good concert tickets, like Taylor Swift tickets. Nobody wanted them.
No way. Oh, wow.
Sometimes we don't even listen.
Right.
Well, we're running out of time, so just give us one more. We have less than a minute left, so just give us one tip of something people can do right now to preserve their vision.
All right. So, one of the things that I'm going to say is a lot of the trauma, these patients that I take care of that have trauma to the eyes, they get involved in activities or they do things without protecting their eyes. So what I'm going to say is make sure you wear your eye protection.
Got it.
So eye protection, and another one is avoid confrontation. All right.
Wow.
Yeah, I mean, avoid confrontation. Trauma to the eye. So first of all, men tend to, when you look at the typical trauma patient, it's always the young male. Okay. Either they're working with a tool and they stab themselves, or they go into a bar and
someone's punched them in the eye.
Yeah, punch in the eye. So trauma to the eye. So Protective
Okay,
eyewear.
don't get punched in the eye, and if you do, go to Dr. Gentile because he's the only
Right.
person that can help you.
And wear protective eyewear.
Thank you very much.
Thank you so
got it.
much. Those stories are fascinating. We can't wait to have you back because I know you have more to
Yep.
tell us, but we're out of time now.
Super. Thanks for inviting me, and thanks, Anthony, for
Thanks.
inviting me.
Boy,
Thank you so
I
much.
love your background there. I mean,
thank you.
that's great. I love it.
Anthony made this one.
Yeah. Have a great night. Thank you so much.